Hi everyone. I apologize for the way that my voice sounds. I am currently getting over a cold, but I will try my best to be as clear as I can. I've decided I want to talk about the BSN Essential 5, which is interprofessional communication and collaboration for improved patient outcomes. This topic is so important because all members of our patient's team need to be able to communicate with each other, and we need to be able to communicate effectively and efficiently. As nurses, this is our entire job, is communicating. We communicate with one another, with our patients, with their doctors, all members. So think about one of your patients and how they're involved with working with the nurses, with doctors, with physical therapy, respiratory therapy, social workers, and some of our patients, that list goes on and on. And because there's so many members involved, we need to understand what everyone's role is, what they cover with their job description. We need to know what all will physical therapy do for this patient while they're here and when they leave. And that goes for everyone. And this will help us provide a complete picture for our patients and ultimately give them the safest possible care that we can. So how do we communicate with one another, and how do we do it effectively? Well, we need to be advocating for our patients. We need to know when something isn't getting addressed, and when they can't speak for themselves, we as nurses need to speak up for them. We need to be able to communicate with their doctors. We need to know when there's a change in status, and we need to tell them about this. We need to be using evidence-based practice and patient-centered care in our daily practice, because as you know, one treatment that we're working with this year, next year we've moved on to a completely different treatment. And while we're working with one another, trying to figure out what the best possible plan for this patient is, we need to be up to date so that we can communicate and we can bring to the table valuable information. So technology plays a huge part in how we communicate, because we're not only communicating face-to-face anymore, but we're communicating via technology. Our charting is done online, patient orders, patient treatments, they're all done over the computers. Patient portals, when our patients leave, they have access to these portals where they can get on and have a nice reminder of what their care is, labs, everything. And we need to be able to communicate this information to our patients. When they're about to leave, we need to be able to explain to them how they do this, because think about how it's new to us and how we struggle. Think about, someone who's not working with this on a daily basis. It's inevitable that we're going to butt heads. But, as much as effective communication is imperative to our jobs, we also need to understand and know how to incorporate different conflict resolution techniques. We need to not only know how to communicate well with one another, but when things aren't going well, we need to know how to fix what's going on and communicate in those situations as well. So I hope what you get from this is just to understand how much we don't actually realize that we rely on this, on good communication skills. It's everything. It incorporates our entire job. So, I hope you got something from this video, and I appreciate you taking the time to listen and to watch.